Certified Medication Aid Exam Questions and Answers.
Question 1. A nursing assistive personnel such as a medication aid certified or certified nursing assistant, which option? Option A, can work within their job description. Option B, is a licensed nurse. Option C, may practice in the same way as a nurse. Option D, cannot be charged with negligence.
The correct answer is option A, can work within their job description. The correct answer is can work within their job description. This is the safest and most appropriate medication aid response for the situation.
Question 2. What is the average daily dose of the oral hypoglycemic agent glyburide, glucotrol? Option A, 2.5 mg to 20 mg twice daily. Option B, 2.5 mg to 20 mg 4 times daily. Option C, 2.5 mg to 20 mg daily. Option D, 5 mg to 10 mg 3 times daily.
The correct answer is option C, 2.5 mg to 20 mg daily. The correct answer is 2.5 mg to 20 mg daily. This follows the medication order and the supplied dosage information.
Question 3. Diazepam is a medication used for anti-anxiety and seizure control. Diazepam is a controlled substance. To which class or schedule does diazepam belong? Option A, class intravenous. Option B, class 2. Option C, class 3. Option D, class 1.
The correct answer is option A, class intravenous. The correct answer is class intravenous. This is the safest and most appropriate medication aid response for the situation.
Question 4. Clarinex is a medication that is available as an over-the-counter drug. The drug's action is to reduce which option? Option A, stomach upset. Option B, gas. Option C, pain from arthritis. Option D, allergy symptoms.
The correct answer is option D, allergy symptoms. The correct answer is allergy symptoms. This is the safest and most appropriate medication aid response for the situation.
Question 5. The medication aid is responsible to know the medical information of which option? Option A, all residents at their place of employment. Option B, residents assigned to their supervising nurse. Option C, all residents on the unit or floor. Option D, residents he or she is assigned to.
The correct answer is option D, residents he or she is assigned to. The correct answer is residents he or she is assigned to. This is the safest and most appropriate medication aid response for the situation.
Question 6. Which of the following is the responsibility of the medication aid? Option A, giving the first dose of a newly ordered medication to the client. Option B, withholding a patient medication without reviewing it with the nurse first. Option C, giving as needed medications ordered after checking with the resident's nurse. Option D, converting medication dosage from milligrams to micrograms.
The correct answer is option C, giving as needed medications ordered after checking with the resident's nurse. The correct answer is giving as needed medications ordered after checking with the resident's nurse. This is the safest and most appropriate medication aid response for the situation.
Question 7. Which of the following is not a role limitation of a medication aid? Option A, call the physician about client status or need for medication. Option B, observe the client's need for, or response to, medications, including as needed medications. Option C, report changes in client status regarding drug therapy to ensure client comfort and safety. Option D, make decisions that might include withholding medications.
The correct answer is option C, report changes in client status regarding drug therapy to ensure client comfort and safety. The correct answer is report changes in client status regarding drug therapy to ensure client comfort and safety because it is the choice that does not match the stated medication aid principle.
Question 8. The nurse you are to work with for the upcoming shift informs you, the medication aid, that she will be late today and asks you begin to administer medications. With regard to this scenario, which of the following statements is correct? Option A, medications that are usual for the residents can be administered without the nurse present. Option B. No, as needed medications can be given without appropriate supervision. Option C. All medications can be administered without the nurse present. Option D. No medications can be administered without supervision.
The correct answer is option D. No medications can be administered without supervision. The correct answer is no medications can be administered without supervision. This is the safest and most appropriate medication aid response for the situation.
Question 9. Maintaining competence refers to the which option? Option A. Knowledge, skills, and attitude necessary to fulfill the role as a medication aid. Option B. Medication aid certified who does not have the necessary skills to do something successful. Option C. Medication aid certified gaining greater knowledge to perform newer skills. Option D. Person who cannot perform the role of a medication aid due to mental deficiency.
The correct answer is option A. Knowledge, skills and attitude necessary to fulfill the role as a medication aid. The correct answer is knowledge, skills and attitude necessary to fulfill the role as a medication aid. This is the safest and most appropriate medication aid response for the situation.
Question 10. Verbal communication skills include speaking clearly and at level residents can understand, avoiding medical jargon, and which option? Option A. Using phrases to stop residents from sharing feelings. Option B. Interrupting patients when they are taking too long to answer questions. Option C. Using authoritative language to get the resident to follow directions. Option D. Asking open-ended questions that discourages a yes or no response.
The correct answer is option D. Asking open-ended questions that discourages yes or no response. The correct answer is asking open-ended questions that discourages yes or no response. This is the safest and most appropriate medication aid response for the situation.
Question 11. Unlawful personal violence toward a resident, for example, forcing residents to take medications despite their wishes, is the definition of which option? Option A. Assault. Option B. Battery. Option C. Neglect. Option D. Abuse.
The correct answer is option B. Battery. The correct answer is battery. This is the safest and most appropriate medication aid response for the situation.
Question 12. Which of the following is a reason for a medication aid to suspect a resident may be a victim of physical abuse? Option A. Refusal of patient to see any visitors. Option B. Skin tears on the forearm. Option C. Frequent crying or periods of sadness or withdrawal. Option D. Bruises in various stages of healing.
The correct answer is option A. Refusal of patient to see any visitors. The correct answer is refusal of patient to see any visitors. This is the safest and most appropriate medication aid response for the situation.
Question 13. Sharing information with others about the resident that could damage the resident's reputation is the definition of which option? Option A. Abuse. Option B. Neglect. Option C. Slander. Option D. Libel.
The correct answer is option C. Slander. The correct answer is slander. This is the safest and most appropriate medication aid response for the situation.
Question 14. Which of the following is an example of an ethical dilemma? Option A. Stealing. Option B. Abuse. Option C. Euthanasia. Option D. Slander.
The correct answer is option C. Euthanasia. The correct answer is euthanasia. This is the safest and most appropriate medication aid response for the situation.
Question 15. On which part of the eye do cycloplegic eye drops work? Option A. Muscles that control the lens. Option B. Iris. Option C. Lashes. Option D. Sclera.
The correct answer is option A. Muscles that control the lens. The correct answer is muscles that control the lens. This is the safest and most appropriate medication aid response for the situation.
Question 16. Which of the following medications are prescribed for the symptoms of asthma? Option A. Inderal. Option B. Spiriva. Option C. Propranolol. Option D. Tussionex. The correct answer is option B. Spiriva.
The correct answer is Spiriva. This is the safest and most appropriate medication aid response for the situation.
Question 17. Which of the following is an example of a trade name? Option A, quinapril. Option B, acapril. Option C, lisinopril. Option D, angiotensin converting enzyme inhibitor.
The correct answer is option B, acupril. The correct answer is acupril. This is the safest and most appropriate medication aid response for the situation.
Question 18. When a drug's action changes a resident's response in a positive way, the drug is said to provide a which option? Option A, dose-dependent effect. Option B, threshold effect. Option C, therapeutic effect. Option D, drug action effect.
The correct answer is option C, therapeutic effect. The correct answer is therapeutic effect. This is the safest and most appropriate medication aid response for the situation.
Question 19. Which of the following definitions explains the metabolism of a medication? Option A, an effect not anticipated. Option B, how the medication is used by the body. Option C, decreases effect over time. Option D, disposal of the drug from the body.
The correct answer is option B, how the medication is used by the body. The correct answer is how the medication is used by the body. This is the safest and most appropriate medication aid response for the situation.
Question 20. The nurse tells you that the blood level of a drug is too high. What do you know from that? Option A, the rate of excretion for the drug is too high. Option B, the resident is at risk for toxicity. Option C, the rate of absorption of the drug is low. Option D, the resident may be taking illegal drugs.
The correct answer is option B, the resident is at risk for toxicity. The correct answer is the resident is at risk for toxicity. This is the safest and most appropriate medication aid response for the situation.
Question 21. An example of a contraindication to giving a patient a particular medication is that the patient which option? Option A, has taken the medication before. Option B, has diarrhea when taking the medication. Option C, has an allergy to the medication. Option D, had an upset stomach the last time the medication was taken.
The correct answer is option C, has an allergy to the medication. The correct answer is has an allergy to the medication. This is the safest and most appropriate medication aid response for the situation.
Question 22. Which of the following situations is life-threatening? Option A, adverse drug reaction. Option B, allergic reaction. Option C, idiosyncratic drug reaction. Option D, anaphylactic reaction.
The correct answer is option D, anaphylactic reaction. The correct answer is anaphylactic reaction. This is the safest and most appropriate medication aid response for the situation.
Question 23. One of the residents assigned to the medication aid certified complains of severe itching. You observe raised, irregular patches on the person's skin. This may be which option? Option A, cancer. Option B, hives. Option C, fungus. Option D, measles.
The correct answer is option B, hives. The correct answer is hives. This is the safest and most appropriate medication aid response for the situation.
Question 24. When a person requires higher dosages of a medication to produce the same effects that once were achieved through lower dosages, this condition is called what? Option A, dependence. Option B, a drug interaction. Option C, tolerance. Option D, a cumulative effect.
The correct answer is option C, tolerance. The correct answer is tolerance. This is the safest and most appropriate medication aid response for the situation.